Jordan Fomby, and I'm a student physical therapist assistant from Jefferson State Community College, and today I'm here to talk to you about Lyme disease. So what is Lyme disease? Lyme disease is a vector-borne infectious disease that is most prevalent throughout the United States right now. So Lyme disease is transmitted through the bite of a tick, which is it can be from different ticks, but the most common one is the deer tick, also known as the black-legged tick. This disease is contracted from when the tick bites a human after it, so say it went and bit a host such as certain birds and mice which carry this bacteria. The tick becomes infected and goes and bites a human, then that human can be susceptible to catch this disease. So the bacteria that this tick carries is called Borrelia burgdorferi, which is a mouthful. But this is a spiral-shaped bacteria, which is, like I said just a second ago, obtained by different species of birds and mice, and is obtained when the tick bites one of them if they're infected with this disease or with this bacteria. Once the tick bites the individual, the infected saliva will travel through the bloodstream and become present between a couple days, months, or even years after the tick has bit the other host. This disease can affect all organs, the nervous system, the heart, the joints, the muscles, and can even cause paralysis and heart problems. So in this picture here, that's the bacteria, the spiral shaped, and this is just a picture of the black-legged ticks. So this stage, or this Lyme disease, can have 3 different stages. You can have the localized stage, so that's the most common stage that is seen with someone when they say they have Lyme disease. So this is just within one spot of the body. It has not traveled throughout the bloodstream yet. And the signs and symptoms become persistent 1 to 2 weeks after bitten by an infected tick. So what kind of signs and symptoms are present with this? Well, you can have the red bullseye rash, which is also known as erythema migrans, or flu-like symptoms such as fatigue, chills, fever, muscle aches, and things like that. Stage 2 is the early disseminated stage. Signs and symptoms become prevalent a couple weeks or months after once bitten. This is where it started, the bacteria is starting to flow through the bloodstream and lingering around to make symptoms worse. This can occur when you don't seek appropriate medical treatment or or the disease starts to reoccur after the stage 1. So what signs and symptoms are associated with this? You can have the same signs and symptoms as stage 1, so the rash and the flu-like symptoms, and you can have things such as numbness and paralysis, pain, muscle weakness, arthritis, and neurological problems such as Bell's palsy, which is weakness of the face muscles, or difficulty with mentation. And stage 3 is the worst stage, it's the chronic stage, and this stage occurs when stage 1 and 2 was not treated appropriately or within the allotted amount of time, and it can be life-altering. So symptoms don't start to arise until months to years after one's bitten, and the bacteria has already spread through the body and starts causing chronic arthritis and increases neurological dysfunction. So signs and symptoms can be arthritis, cardiac problems, sleep disturbances, numbness within the muscles, pain and stiffness within joints, fatigue, and increased neurological dysfunction. And right here you can see the red bullseye rash, and then you can see stage 2, so you have the rash, the muscle weakness in the face, and the swollen knee, and stage 3, which can have heart complications, arthritis, psychological problems, flu-like symptoms, insomnia, and a lot of other problems that can just lead to other medical conditions if not treated appropriately. So the diagnosis and prognosis. The diagnosis for the disease is actually very hard to do because this disease can mimic other medical conditions. So if you have like a red bullseye rash with flu-like symptoms, and that's an indicator that you do have Lyme disease, because the red bullseye rash is what they look for basically, but sometimes you cannot have it. And then you can have a blood test done. It's called the enzyme-linked immunosorbent assay, which can be used. So say you got bit by a tick 3 days ago, haven't had symptoms yet, you can go get this blood test done, and that will make sure that you catch it before any symptoms start to arise, so you can start the recovery process then. The prognosis is actually really good if you catch it within the first stage. The longer the symptoms go untreated, the worse that the disease gets. So if treated within the allotted amount of time, most individuals will have a good prognosis and will be able to return to a functional state with little to no symptoms or pain in the future. Let's see, so who can contract this disease? Well, any individual can that are susceptible to this disease. So areas such as woods, brush, and tall grass. And activities such as hiking, camping, hunting, or anything adventurous outdoors where you're within areas like this, you can catch this disease if a tick comes in contact. So that's just the woods and the tall grass that you could be within. So medical treatment is antibiotics. So that's what the doctors will start treating it with. And it's crucial that you take all your antibiotics or your other medication that's given, because it could reoccur if you just stop taking the medication halfway through. So other medications may be given in, say, the stage 2 or stage 3, and along with antibiotics to help relieve some of the pain and other symptoms that you're having. Physical therapy is also greatly beneficial for medical treatment, because this is going to help increase range of motion and strength, and prolonged and adequate amount of rest is needed. So like we've been talking about before, just the impairments and functional limitations that are present is arthritis, muscle weakness and paralysis, joint pain and stiffness, fatigue and decreased strength, and decreased cognition. And so what is the goal for physical therapy? Well, the primary goal of physical therapy is to increase the functional capacity of a patient and decrease joint pain and increase range of motion and strength during the recovery period. So you're going to want to improve any range of motion and decrease the chance of physical abnormalities that could be seen in the chronic or late stages by doing these exercises. So this is just a short list of some options that you have. These can be done within any stage of Lyme disease. So you have therapeutic exercise, manual therapy applications, and modalities. And more things can be added, or they might not need all of this, just depending on the patient and what level they are and their functional ability as of being diagnosed. So therapeutic exercise is going just to help keep the joints functioning smoothly. It's going to decrease joint stiffness and pain, and it can be essential, or it is essential for maintaining strength and endurance to keep the patient within their prior functional level before being diagnosed. Manual therapy applications such as joint mobilization can decrease pain and stiffness within a joint and also help with the recovery process. Modalities such as a hot pack can be used. To relieve pain, it's going to help give mobility within an area and help with exercises and pain. But you want to be careful when you're using hot packs, because if they have inflammation or have like side effects of paralysis, then that would be contraindicated, because you could burn a patient or make things worse. So precautions for physical therapy. So patients with this disease fatigue very easily. So adequate amount of rest breaks is needed. So you could do things like decreasing the intensity and increasing the rest breaks. So a gradual increase is very crucial in physical therapy, so a patient does not become or fatigue quickly. So what should a patient do to prevent this disease? Well, there are many things. You have vaccines, tick repellent sprays, and checking your clothes or hair and pets thoroughly. If you notice that a tick is attached, remove it as soon as possible, but make sure you remove it with tweezers and not your hands, because the head could remain in the skin. If the disease is spread, or the disease is spread into the host within 34 to 48 hours, so remove the tick as quickly as possible once you notice it, to decrease the risk of catching this disease. And you want to make sure that you seek medical attention once you notice if you come in contact with a tick, just to make sure. And so, don't let small insects ruin your adventure. Thanks. If you have comments or questions or comments, comment below.